Good afternoon, I'm Shania, and this is One News Now. The Mines and Geosciences Bureau, or MGB, has completed drafting the implementing rules and regulations of EO 130, which lifts the ban on new mining deals. Shyla Francisco joins us live from Taguig with more details. Hi, Shyla. What do we know so far about the new IRR?
Sean, the MGB is set to present the initial draft IRR to Environment Undersecretaries today. The agency, however, refuses to divulge the content of the IRR, noting that it's still subject to changes. After meeting with DNR Undersecretaries, the MGB will then invite stakeholders 2 weeks from now to sound off the content of the IRR before presenting it to Secretary Roy Cimatu. The agency earlier said it targets to finish and submit the IRR within a month. One of the projects seen to benefit from the EO is Felix Mining Silangan and Copper Gold Project. For its part, Felix Mining is optimistic that the EO can help attract a potential business partner as they are still actively looking for one. The MGB is also banking on Congress's support regarding their proposal to obligate mining companies to set up mineral processing plants in the country. The agency noted that a law is needed to provide incentives given the high cost of electricity, which discourages potential investors. Electricity makes up 40% of the mineral processing plant cost, which is estimated at around $180 billion for 10,000 ton capacity. They are also proposing that the same law will allow clustering among miners with same commodities to put up capital to construct one. Sean, the MGB says it needs Congress's support to help review and amend the existing revenue sharing agreement between the government and mining firms. Currently, the Mining Industry Coordinating Council is reviewing the environmental aspect of the existing mineral agreements as instructed under EO 130. Sean?
Thank you for that update. That was Shyla Francisco joining us live from Taguig. In other news, actress and philanthropist Angel Locsin explained what happened at her birthday community pantry in Quezon City. In an Instagram post, Locsin said they were handing out stubs to keep the distribution orderly, but things went out of hand due to unexpected long lines which led to overcrowding. The actress said they sought the help of law enforcers to keep the pantry in order.
Nagsimula po kami na maayos pong aming layunin, pati ng aming pagpaplano ng social distancing. Nagkataon lang po talaga na siguro gutom lang po talaga yung tao na kahit wala po sa pila, sumingit na po sila. Sa mga nagambala ko po dito, pasensya na po, hindi po itong intensyon ko.
And lack of funding and healthcare personnel are preventing hospitals from expanding their bed capacities for COVID-19 patients. In an interview with One News's Agenda, Philippine Hospital Association President Dr. Jaime Almora said that the problem with hospital resources had been around even before the pandemic. He also lamented the seeming policy disconnect among the Health Department, PhilHealth, and other concerned agencies.
Number one is yung personnel, which I call it personnelitis. May sakit ang hospital sa personnel, manpower kulang. Nagkakaroon ng disconnect yung mga ini-issue nila na AO, saka mga administrative orders, saka mga circulars, especially between DOH and PhilHealth.
Here are other stories we're keeping our eyes on. The Foreign Affairs Department lodged 2 new diplomatic protests against China over its continued illegal presence in the Philippines' exclusive economic zone. The country's maritime law enforcement agencies reported that at least 160 Chinese fishing and maritime militia vessels are still moored in the area as of April 21. 5 Philippine universities made it to this year's Times Higher Education Impact Rankings. And these are the Ateneo de Manila University, De La Salle University, the University of Santo Tomas, Tarlac Agricultural University, and Mapua University. The THE rankings measure the sustainability efforts of universities worldwide. And Typhoon Bisig's damage to agriculture in the Bicol and Eastern Visayas regions has hit 218 million pesos. Infrastructure damage, meanwhile, is pegged at around 10 million pesos so far, according to the NDRRMC. The COVID-19 pandemic has pushed India to the brink of a humanitarian crisis. The South Asian country is still shattering global infection records. Johns Hopkins Center for Health Security senior scholar Jennifer Nuzzo talks about that in this video from Bloomberg.
How far are we from a humanitarian crisis in India?
Oh, I mean, we're on the brink. The stories that really worry me the most is hearing about shortages of medical oxygen. I mean, to think that, you can save people's lives by supplementing their oxygen and they just don't have it. Oxygen, something that's easy to make, that is really, I think, a severe tragedy.
How close are we to shifting to, say, 1947 and the starvation of Europe, the Netherlands, post-World War II Europe? How close are we to where there will be a call for international developed nation and American responsibility to assist India?
Oh, we are there. If the call hasn't already been sounded, let's sound it now, because there is clearly a deep, deep struggle there, and they need help. And, the United States is not going to be back to normal, fully safe, until we help countries end these very concerning surges of these cases.
Based on the surges that we have seen, how much has the end of the pandemic been pushed out?
Well, I mean, it's really hard to say. I mean, we still have parts of the globe that haven't gone through this yet, and you don't want any country to go through this where you see a massive surge of cases. But any country that has not yet had a surge of cases and is not actively vaccinating its population remains at risk to exactly this scenario. I think earlier there were countries that maybe breathed a sigh of relief, that somehow assumed that they escaped the worst of this pandemic. But we're seeing quite clearly that that's very much not the case, that many parts of the world still remain deeply at risk. So I worry about these headlines continuing for a year or more unless international partners get together and help share some of the vaccines that are there. We need to absolutely make more vaccines. There's clearly a shortage of medical supplies that needs to be addressed. So a lot of work that the globe can do to help countries and to, try to lessen some of these hideous tolls that the pandemic's already had.
We need to make more vaccine, and we need to convince people to actually get inoculated. John touched on the fact that there is a slowing pace of vaccinations in the United States. How concerning is that?
It is quite concerning. I just read a study about an outbreak in a nursing home where most of the residents were protected with vaccines, but only about 53% of the healthcare workers in the nursing home here in the U.S. Had been fully vaccinated. And unfortunately, one of the residents who had been vaccinated, and this can happen particularly in medically frail individuals, died. So this is a real problem. And then, of course, we're hearing about states pulling back on ordering vaccine, that they are not having the kind of uptake that they had been having. This is something that I think we have to address with much urgency. I think there are some people who are probably just trying to wait and see. I think there are some people who don't feel that they want to get vaccinated, but we need to reach both of those people, both of those groups of people, and convince them that, your time to get vaccinated is as soon as you're able. And the faster we do this is the faster we get back to normal.
What a tough moment to be a leader of this country right now and make this decision, Doctor, because there is so much pressure to take some of the supply here and allocate it to the rest of the world where it's needed most right now. How do you make a decision like that when some parts of your country have decided they don't want this vaccine?
Sure. Well, it is a tough decision, and every elected official, their first responsibility is to the people who elected him or her. In this case, though, the United States has more vaccines than we need. Even if every single American were to get a vaccine, we still have more than we need. And so I think it is important for us to consider donating, at least to cover some very high risk groups like healthcare workers that are working across the globe. They show up every day, put their lives on the lines to save people's lives. We should be able to protect them. And the U.S. has enough vaccine to be able to help in those efforts.
For more updates, visit News 5, The Philippine Star, and Business World online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on the Signal Play app. Register for a free account at www.signalplay.com and stream One News live anytime, anywhere. Mask on, wash hands, and stay safe, Philippines. I'm Sean Yao. We are One News.